Hello, everyone. The webinar will start momentarily. Hello, everyone, and welcome to today's webinar. We do have Dr. Eugene An as our panel moderator today, as well as Dr. Weidong Liu, who will be your presenter. Dr. Eugene An, please take it away.
Hey, good afternoon, everybody. This is Dr. Eugene An, medical oncologist at CTCA Chicago and co-chair of the Communications Committee on the SIO Communications Committee. And it's my pleasure to introduce Weidong Liu, MB, MBH, and PhD, who will describe the use of Chinese herbal medicine during COVID-19 in China and review relevant clinical data in the prevention and treatment of respiratory virus infections and discuss some safety issues concerning Chinese herbal medicine. Dr. Liu is the lead oncology acupuncturist at the Leonard P. Zachem Center for Integrative Therapies and Healthy Living in the Department of Medical Oncology at Dana-Farber Cancer Institute, and he's instructor in medicine at Harvard Medical School. And in particular relevance to SIO, he's one of the founding members, and in fact, according to our records, he's the only SIO member who's been to every single annual conference meeting. And unfortunately, COVID-19 will break that streak, since it unfortunately will result in a delay of the SIO meeting until next year. But perhaps as a part of a response to this, it's our pleasure to introduce Dr. Weidong Liu.
Thank you, Dr. Ang, and thank you for the SIO invite me to give this webinar. I think this is I try to share some my understanding about the Chinese herbs that used in the COVID-19, and then we're going to looking at the evidence and other issues related to the use of Chinese herbs during this period of time. And so I really appreciated this opportunity. So this is let's start it. So this is my disclosure. I have no any conflict interest. My talk today is break down this couple aspects. The first one, I give you some general background about Chinese herbs in practice for people who are not familiar with the Chinese herbs. And we'll go over a little bit on the coronavirus outbreaks. We all know that. And then I will present some of the current use of Chinese herbs in China, what they did, and then we'll go over some clinical research evidence in the prevention of viral infections, which is beyond COVID-19, and also in the treatment of the viral infections. And we'll also get into some preclinical research and some single compounds. We'll touch upon some safety issues, then we'll summarize up, and I will leave about 10 minutes to have questions and answers. So this is a picture of the from Nature magazine and taken from Beijing, China, and it shows it is one of the herbal dispensary in China that they dispense Chinese herbs. So this is a practice that have been used in China for thousands of years, and we have a term called the TCM, and traditional Chinese medicine, and the majority part of TCM actually is called Chinese herbal medicine. And I think it's data shows it comes out over 90% of our practice actually Chinese herbal medicine. So this is the opposite is what happening in Western countries. In Western countries, we tend to think about more acupuncture versus the herbs, but in Asia, that is opposite. And herbal medicine is much more dominated than acupuncture. In Asia, and Chinese medicine is not only limited in China per se, and as you can see, we have a new term called East Asian traditional medicine, which are all influenced by the TCM. And here in China, they call it TCM. In Japan, it's called Kampo medicine, which is a traditional Japanese herbal medicine. And in Korea, called Korea traditional medicine. In Mongolia, traditional medicine, and Tibet, traditional medicine. So they all into the category called the East Asian traditional medicine. So keep that in mind. So the herbal medicine, Chinese herbal medicine, is not only limited in China anymore. So this person called the Yellow Emperor, and he's considered to be a founder of a Chinese medicine. Look at it at the time; it was quite a while back. This Yellow Emperor has a book. He wrote a book about the medicine. In his book, his philosophy of this defense system of the body, and has a very, very famous two statement that he made. I think it's a very, very well described what we are facing right now. What he says is that where is sufficiently healthy qi inside, and pathogenic factors have no way to invade the body. So that is how the Chinese medicine looking at our body to defense outside pathogenic factors. So we need to cultivate our healthy qi. This is really important. That's why it may explain why some people get sick and other people are not getting sick, even we are exposed to some pathogenic factors, including bacteria and other virus currently. Another sentence from Yellow Emperor, he's thinking is that where pathogenic factors accumulate, the parts of the body must be deficient in the vital qi. So if someone getting sick, and there must have some vital qi deficiency. This vital qi, healthy qi, all we talk about the same thing. And broadly, we can refer to our general immune system. The common type of Chinese herbal medicine practice are, you can see these are kind of 4 types. Just a very, very simple, high-level description. One is called individualized formula. You can see it's very classical. You use the roots, bark, dry roots, leaves, bark, and make a tea out of this. So this practice is very ancient, very classical, and it's still being practiced widely in Asia, in China, and sometimes in Chinatown, United States. People use that. However, of course, it's not very convenient. And so we have now people have another called tea pills, or grind into this, grind into the powder, make it the tablets, make it a little easier to take. Then the third is called the dried extract powder, which this actually I want to emphasize. This is most commonly used in Western countries, and this is a powder that's manufactured in the factory, and GMP certified factory, and highly concentrated, and quality control usually is pretty tight. Both tea pills on dry extract powder has been making into various formation of we call it pattern medicine, which is like tablets, capsules that is easy to use. But the extract powder is much widely used, for example, in Japan, in Taiwan, in Hong Kong, United States, Europe, but not as common as in mainland China. But they're catching up right now. They're doing this right now as well. The last step is chemical compound, which is once we understand the detail, exactly chemical compound, herbal medicine will become a drug. Whether you like it or not, but that is another thing that's in some places they do use that, but so you can consider that is from the herb one to the drug. So this is a common practice that using in practice currently. Let's talk about the coronavirus. And as we all know, coronavirus this currently is affecting every aspect of our life, and many people died from it. But the coronavirus is not. This one is not new. We talk about COVID-19 that started in 2019 from Wuhan, China. But the coronavirus had been with us for a long time. And for example, in 2003, there's SARS, and caused by this virus called SARS-CoV-1. And then we have a Middle East respiratory syndrome called MERS. That's happening in 2012, 2015, 2018. And now we have a COVID-19 that's caused by the virus called SARS-CoV-2. So remember these two things are very similar. SARS-CoV-1, SARS-CoV-2. They're brothers and sisters. So coronavirus is not new to us. I should want to make sense, and they're linked. So this is the same, similar, and you can see this virus, this SARS virus, SARS-CoV, and the COVID-19 is SARS-CoV-2, and that's a MERS-CoV, the virus. They're all very similar. They're all type of a coronavirus. Well, people wondering that can any alternative medicine or remedies can be treating COVID-19? And we need to review this the statement put out by NCCIH. They say that there's no scientific evidence that any of these alternative medicine can prevent or cure the illness caused by this virus. I think they refer to this COVID-19 virus. In fact, some of them may not be safe to consume. So I think I'll keep that in mind when getting into the next talk. So now we are trying to describe. I try to describe what happened in China and how they changed the herbs used in China. Well, in China, the fact is that the Chinese herbal medicine has been widely used during this epidemic. The use from prevention and treatment and the recovery. These three phases. So what you see here is the government, Chinese government statement, the treatment protocol. Okay, the treatment protocol issued by national. It's an official document, National Health Commission. This is the 7th edition, trial version 7 for the diagnosis treatment protocol for novel COVID pneumonia. This protocol is applied to all the healthcare workers in China, not just only for the alternative medicine practitioners, and all these Western medicine doctors and all the health practitioners that are treating COVID-19. So in this document, it stated this Chinese herbs can be used in medical observation period time, can be used in a clinical treatment, and can be used recovery time. And so here, then we look at this this Chinese government had a news conference, official news briefing on the March 23rd in China. This what they said. One is that Chinese herbs are widely used in this epidemic for prevention treatment in China. And about all the medical staff when Hubei, China, during the outbreak, 13% of them were TCM-related healthcare workers. There's over 4,000, close to 5,000 doctors are TCM-related, and they said that the 91% confirmed case were treated with a TCM in China. There's over 70,000 cases, and they were either being treated herbs alone or integrated with Western medicine together. And what they claimed, I always say the word claim, the overall effective rate is over 90%. Okay. Then they find that this the benefit of this is that it can alleviate the symptoms, reduce the conversion rate from mild case to severe types, and improve the curative rate and reduce the mortality rate, improve the rehabilitation during the recovery phase. So that's what they think, and or at least claim. what the Chinese herbs are using during this period of time of benefit. And another thing is they said that they discovered this some effective regimens. They call it 3 drugs and 3 formulas in this 6 relatively regimens. So but I want to emphasize this is just on these slides are not from published peer-reviewed journals. Okay, and this is presented at a Chinese government official news briefing. They didn't give any too much details about how they come out with this data. So keep that in mind. So, news briefing cannot be considered as evidence. So where is the evidence? So let's looking at this. So this is a statement from Nature magazine, and I think the author has this interesting statement. They say that epidemic diseases are not a new phenomenon, which is true, and perhaps some botanical understanding can help slow them down. By looking back, we examined some peer-reviewed journals. We could find that some of our published data suggest that Chinese herbal medicine has been used for the prevention of viral infections. So here is one of the examples. This is a meta-analysis and using for Chinese herbal medicine in the prevention to reduce the infection rate of the H1N1 influenza. So this is the paper put together of some the randomized controlled trials. Here is 3 trials, and they all try to using these these herbs try to prevent the H1N1 influenza infection. But the number are very small. Okay, the data number small. What they found is that it's appeared that this prevention strategy seems help favor the prevention. The summarized the effective rate is 0.35. So you can see here it suggests this prevention was helpful, and statistically it was significant. If they combine the larger number, which control not only randomized control trial, but also non-randomized control trial, but the control trials, this number are higher, much higher, and the conclusion was similar. So in that paper, it suggests that use herbs to Chinese herbs to prevent the H1N1 influenza seems to show some benefit. And this is an interesting paper published in 2005, which describes a perspective of the cohort study that using the herbal formula by hospital care workers during the SARS in Hong Kong. They try to see if they can prevent the catch of the virus, and if they can reduce the symptoms or improve the quality of life. But this is not a randomized trial, but it's a prospective cohort study. So in this trial, they recruited the patient, not patients, healthcare workers in the hospital, nurses, doctors. It's 11 hospitals in Hong Kong during the SARS outbreak. So they have about 1,000 people. They give them a Chinese herbal supplement, a package. So they take 1 pack a day for 2 weeks. The same healthcare worker in the same hospitals who did not take in the herbs used it as a control. So the result is that they find that after 1 month, because the Hong Kong government has a registration database, anyone who affecting being confirmed has confirmed cases will show up in this the database. So they checked on this and they did a survey on afterwards. They find that none of these 1,000 herbal supplement users had contracted the SARS virus, whereas the control group, that had about 64 cases out of over 15,000 cases have been diagnosed with the SARS. Right. So so that's very interesting, and see the happening. This is they looking at their quality of life among these herbal users. Use the SF36 to measure their mental health status and vitality health, which is a subcategory of this SF36. You can see here during this, they measure for about 4 weeks of time from the baseline to end about 4 weeks. There's a significant improvement regarding these people's mental health and vitality. They also examined their visual analytic skill, examined their herbal use regards influenza-like symptoms. Okay, even they didn't have been diagnosed with the SARS virus, but some of them did show some symptoms. So they find this, the chill symptoms, the regular symptoms, the muscle symptoms, headache, okay, and cough. In addition to the regular symptoms, other than the chill, cough, all show the significant differences compared with the baseline when they started to the end of 4 weeks of a period of time. So this is the show some symptom improvement. Then they're looking at the side effects, because it is a prevention trial and a larger group, and they will see if they are actually had any side effect from this supplement. So what they report, they find that only about 1.8% the users report some mild side effects like diarrhea, constipation, sore throat, insomnia. So it's a relatively mild adverse event. So similar study has been conducted in China as well. So there's 3 studies. I don't have time to go over every study. Just an example. These are lists of herbs, name of the herbs that have been used in these 3 prevention trials in China. And currently in China, during the COVID-19, there's many local healthcare authorities, like I see 23 provinces in China, all issued this called prevention formula, herbal prevention formula for general population. And the author here compile all this data together, and they did a frequency analysis and see what kind of herbs come out and mostly frequent recommended, and they will came out with 2 herbs had been frequently recommended, about 16 out of 23. One is called Huangqing in Chinese, called astragalus. Another called licorice and ganzhao in Chinese. So it's very interesting. So, but if you look at the astragalus, and there's actually a tons of a lot of these preclinical studies suggest that astragalus does have protective effect in the animal studies, cell line studies for example, this for the influenza virus, and inhibit avian infections bronchitis virus, and this other. So it's a preclinical studies seems does support the astragalus does have some protective effect for the virus infection. And another is licorice root, and we all know that. And there are actually, and many studies have been looking into the antiviral effect of the one of the components called glycyrrhizin in the licorice root. One interesting report is published in the Lancet in 2003 during the SARS outbreak, and what the research, I think, is the research come from Germany, and they were suggest that their study find that glycyrrhizin and can disrupt the replication of the SARS-associated coronavirus in cell, in viral cells. The author think that glycyrrhizin was the most active inhibiting replication of the SARS-associated virus. the picture shows here, this is the control, which is the normal cells. The B panel, it shows virus attack the cells. And the C and D shows C is a high dose of the glycerizing, which is that it can pretty much similar to the control group. And the D is a low dose glycerizing. It's very interesting on that. So this is just a picture that herbal picture that for prevention package used in one of the hospitals in China. It's liquid and to their patients or patient families. So this is I'll talk about the prevention, Chinese herbs for prevention. So now let's look at treatment and for viral infections. What kind of data out there? If you remember, I just mentioned that in this news briefing in China, the government claimed that they discovered these 3 drugs and 3 formulas. What that means? The drug means actually the pattern medicine, herbal medicine. It's not a pharmaceutical agent. These 3 pattern medicine are these 3. Just list here. Okay, if we make it easy, called the JHQG, LHQW, and the XBJ. You can see here the one that JHQG is one of the recommended and claim they be effective to treating COVID-19. Does it? Okay, we looking at it. Turns out is that this JHQD actually is this one. There's a paper published in Annals of Internal Medicine and in 2011 describe one formula called MY herbal medicine. This name treating H1N1 influenza, and then compare this effectiveness with oseltamivir. Oseltamivir is the Tamiflu in commercial name, right? And this was a prospective non-blinded randomized control trial. The trial was conducted in 11 hospitals in China and recruited about over 400 lab-confirmed H1N1 influenza patients. The trial looking at is 4 groups, okay? And one group is oseltamivir alone versus Chinese herbal medicine, which here is called MY alone, and versus oseltamivir plus Chinese herbs, so combination. That's typical integrative medicine approach. Then versus no treatment. They gave the patients for 5 days, and then they're looking at their outcome. The primary outcome is the time for fever resolution. The secondary outcome was the symptom score and the viral shedding rate among them. So this is the results here. And what you can see here is that the control group, which is people taking nothing and naturally stay home and was in the high curve, in the high control. This is the hours. Okay, this is the fever percentage fever. So the bottom line, the solid line, the lowest, which is the best results, is the oseltamivir plus MY plus herbs had the best results. And then in between is herbs curve and then the oseltamivir curve. All these curves, these 3 active treatment group, whether the oseltamivir alone or the herbal alone or the combination, all significantly better than the control group. So here is exactly detail. So this, so the significant, they find a significant reduction of this median time for fever resolution compared to the control group is about 26 hours different. Okay, and more than 1 day earlier to resolve the fever. When you compare with the drugs alone, herbs alone, and the combination group arm alone, they are better than the control group. Well, interesting here is that you can see the second line here. The time to fever resolution was reduced by 19% if when you compare oseltamivir plus Herbal group compared with oseltamivir alone. So it suggests the combination group seems does better than drug group alone. And however, but the symptom score is no different. You know, they didn't see the improvement in symptom improvement, but the fever resolution does improve. And they have some minor side effects, and from the Herbal group. So this is the virus shattering and rates, and they didn't see too much difference, and this is no significant because there's too many people drop out, and that's one of the reasons the author suggests. But if you look at detail, this is solid line is a combination group. You know, statistically, there's no difference. All right, so this is the well, go back to this the drug here, and at this study, the popular patient they give a name called Maya, but actually they changed the name afterwards, so it came out a commercial available product. So this is a second one that had been recommended in by the in China, called LHQW, make it easy, called LH. This is herbal capsules, and also usually in the COVID-19. This product also was developed during the SARS outbreak during the time. Does this pattern medicine have any evidence that help? Let's look at this. So this is published in 2014, a meta-analysis of randomized controlled trials, and looking at this we call it LH, okay, in Chinese called the Lianhua Qingwen, you know, we call it LH capsule, compared with oseltamivir with the influenza A virus infection. So they basically similar study design, a randomized controlled trial, look at the efficacy of the LH compared with oseltamivir with the treating influenza virus infection. Just make it a simple, quick. The conclusion from this meta-analysis is that they found the LH had a shorter duration of fever, cough, sore throat, and body aches, as compared with oseltamivir. And but the viral shattering was similar in these two groups. There's not much difference. So this is some detail, and they actually in this study they including the five studies here, and they show this significant statistical significant difference when you compare with this LH with the drug group. So the size, the sample size, you know, about 300 versus 300, so the 600, and some is they have some problems, you know, not quite only one double-blind study, but the other studies were not blind, okay, not unknown. So the quality of the studies have some problematic. So keep that in mind. And Cochrane library and in Cochrane review, which is considered the highest rigorous review looking into the interventions. Cochrane review published a paper in 2012 looking at the Chinese herbal medicine compared with the Western medicine. So it's an integrated medicine approach to treating SARS, severe acute respiratory syndrome, and see if they have any benefit, and versus the Western medicine alone. So it's a combination therapy versus standard of care in that sense. In this trial, the paper, they including the 12 RCTs and plus one quad RCTs, and with the including is over 600 SARS patients, and then they're looking at their the outcome. The conclusion from this paper is that the combination therapy, which is the Chinese herbs combined Western medicine alone, does not decrease the mortality rate. So the people still die the same rates as when you use herbs or use Western medicine. However, it seems to suggest that the combination therapy may improve the symptoms, may improve the quality of life, and also may improve the absorption of permanent lung infiltration, and could decrease the corticosteroids dosage, because the steroids using corticosteroids using is very, very heavy in SARS treatment. And also, this another things that make us a little comfortable is that they don't see severe adverse event in this combination therapy. So it gives some sense here. So let's looking at some preclinical investigation. So look at what possible the mechanism and of the Chinese herbs, and maybe some single compounds maybe will help we to understand how and why the Chinese herbs may be used against the viral infections. In order to understand this, we had to looking at one thing is looking at this some basic science slides here. So we found that the study shows there's a SARS-CoV-2, which is a virus caused COVID-19, very similar to SARS-CoV-1. I use the one here just try to separate, make it clear. Caused the SARS. They're very similar. They are coronavirus. However, keep that in mind. They have a 79% genetic similarities. They are similar, but they're not exactly the same. They're like brothers and sisters. 79% similarities. But one thing they are same. They all rely on to using these called ACE2 receptors to invade our system. The ACE2 receptors is the receptor mostly distributed in our lungs and other organs, but lung is abundant. So they found that this virus need to attach to the ACE2 receptors in order to invade our cells and cause damage. Okay, so this is one of the important, the basic scientific understanding how these viruses are affecting us. Well, recently there's a paper. This paper actually has been published officially on the pharmacological research from China. A study group they reported that this LH, which I mentioned, this herbal pattern medicine, exhibit antiviral and anti-inflammatory activity against the SARS-CoV-2. Okay, this is a study. This is what they found. They compare the antiviral activity of LH and remdesivir. You know, the remdesivir is not a very popular antiviral medicine that very hopeful could be the medicine for COVID-19. They compare these two regimen and against their this COVID-2 virus in the renal E6 cells. So you can hear in the left panel, this is a LH, which is the herbal group. This on the right is the remdesivir group. And you can see here, they all show the inhibiting rate from 0% and gradually as they increase the dosage and their inhibitor rate goes up, and the same as similar to the remdesivir. However, if you're looking at the dose, you can see even they are achieve a similar inhibiting rate effectiveness, but LH require much higher dose, much higher dose than remdesivir, right? So this is and also this is dose response to the virus with on LH. High dose, the better results. Lower dose, less good results. And LH also find that this mRNA expression level, look at the inflammatory mediators, and they find that LH could inhibit some of the inflammatory mediator, for example, TNF alpha. Is dose dependent. The high dose, and they have a much more inhibiting its TNF alpha, and as compared with the control group. There's other similar things that the results in IL-6 and CCL2, all these inflammatory mediators, and it seems to show that the LH has some anti-inflammatory property. This is another example here that another paper recently published, and there the researcher looking at using computational method, which is a computer analysis, to looking at the structure of the currently available drugs and the natural product, and then they were looking at compare with this virus structure in the SARS-CoV-2 structure, and see if they can give them some clue that some of these drugs and the natural product maybe could disrupt the virus, and maybe could be used for the future drug development. So this is what they did. They did is that they found that's what they did. They used a computer to analyze all the database, natural database, herbal database, drug database. Then they looking at the structure differences, chemical structure differences, compare with the ACE2 receptors and the virus, the structure. Remember, and the virus, this SARS-CoV-2 virus is a protein. You can see green here stuck out. They call it a spike. Okay, spike called S protein, and this is a deadly site that attacking our cells. This spike protein connect with the ACE2 receptors, then it will invade our system. So these are two critical sites. One is a spike protein called S protein. Another is S2. What they find here is that they find that they find many active compounds. All right, I don't talk about this and don't have time. But what I find one thing interesting is they find one natural compound, which is called hesperidine. Hesperidine is an active compound from a citrus. Okay, the citrus. They found that this hesperidine actually can fit into this shallow pocket of the surface of a virus spike protein. Okay, they can sit there very well. Okay, and so it bound together the spike protein, which that suggests the hesperidine may disrupt the interaction of the ACE2 receptors with the spike protein together. So here the picture shows this is a computer simulated. This is a virus, and this is S2 receptors. This is hesperidine. So hesperidine sits between and S2 and S protein receptor and protein, and it may cause disruption. So that's but this is just a computer simulated, and so whether that's actually true required further study. Right. And this another paper suggests this called emodine. Emodine is a natural substance that active compound from rhubarb root, and so the emodine that has been shown can block the SARS. Okay, here is SARS. Remember the paper published 2007. SARS coronavirus spike protein. SARS virus also has spike protein. Again, very similar, and also the ACE2 receptors interactions. Okay, so this is interesting. So this is the paper shows, and they found that when you have a high dose of the emodines, and it could inhibit this interaction between the SARS-CoV-1 S protein and ACE2 receptor combination, so they can inhibit this. So you can see here, this data show the higher and the more inhibiting rates that can be presented here. So that's also, these two natural compound give us some clue. Give us some clue. So let's looking at this, and Chinese herbs safe, because that had been issue. As you remember, the NCCIH statement showed that some herbs might be causing harm. So we need to keep that in mind as well. So this is a paper published looking at Chinese herbs, not this COVID-19, just general herbal product. The published in a few years back. They examined 26 samples, which they bought from a local Chinatown the stores. It's including tablets, capsules, and some teas. Right, and what they found is that there's a significant amount of samples are not compliant, and not compliant for DNA, which means they are not what is stated in the label. The label state is different than what they find in the test, and non-compliant for the toxicology, and non-compliant for the heavy metals. Or some of the herbs may contain heavy metals. Only two that did not detect anything. Okay, so that would suggest some of the quality issues that in the Chinese herbal medicine is a concern. So keep that in mind. But what currently available are these toxicity tests on the Chinese herbal medicine are mostly focused on these the tea pills. They were sold in Chinatown, and so these are being examined. However, there has not much examination on these GMP certified extracted powders, which actually is mostly used in practice in Western countries, in Japan, in US, and in Europe, in Taiwan. This is extract powder is actually is a mainstream. In Asia, the number 1, number 2, which is the individual formula tea pills, are most common. So we need more studies to looking at that on this. However, this is one thing I want to point out. People say, "Oh, this is so effective. Maybe I can have my American friends taking this 3 drug 3 formula." I will tell you to hold on, because what claim or recommend by Chinese government may not be may have some issues. Okay, so don't just simply copy what they recommended and use it if you want to do that. And because, just give you an example, in these 3 formulas, if you're looking into the detail what the herbs actually they use, there at least 3 of them are concerning. One is called ephedra, ma huang. Another called asarum. The number 4 is the tesselego. Actually the ephedra or the ma huang is banned in the United States by the FDA, right? And since 2004. So if you use it, you sell it, and you maybe break the law, and so keep that in mind. Then this asarum here, looking at this, asarum is one of the ingredients, herbal species, and using in these formulas. Has been controversial because some studies suggest that the asarum contains aristolochic acid. What is aristolochic acid? Aristolochic acid is a toxin, okay, renal toxin, and has been known to causing kidney damage and possibly cancer. So this is one of the studies, 2017. They examined many samples of this species, and they discovered many of these samples contain aristolochic acid. All right, So that's the you have to be watchful for. Then another thing is called Tosoligo. Tosoligo is the herbs commonly used in Western herbal medicine as well, and in Chinese herbal medicine as well, and also appear in this officially recommended formulation by Chinese government. And well, it turns out that Tosoligo actually have been found to contain this called alkaloids called polylidizing, and the alkaloids. And this is the one paper shows this is spike 1 and spike 2, and also indicates the Tosoligo contains these alkaloids, and this also is a quite well-known toxic compound, and may lead to some liver damage. So I'm not saying that you taking this you will die immediately, but long-term high dose use and definitely is something that you want to reconsider. So not everything is what you're looking like, so you have to be careful to looking at that. I want to give you ends up with what's going on in China here. This is the one paper looking at these clinical trials. So looking at the effectiveness, efficacy of use of Chinese herbs, any other drugs that being reported in China. That's 2015. So you can look at this. There's almost about half, 50%. They use clinical trials, use of traditional Chinese herbal medicine and a combination with integrated medicine approach to against the COVID-19. And also they test other regimen as well. And just a couple of days ago, I looking at the clinicaltrial.gov and see if any clinical trials are ongoing right now. So I discovered at least 7 clinical trials ongoing. And so that's our list here. So while we're looking for some more data will come out in the future. So summarize up. One is Chinese herbs has been used in China, prevention and treatment. Whether it's effective, we don't know because there's no published the randomized trials directly against the COVID-19 has not been available, has not been published. There's no data there. So you can't make a claim. So I think the NCCIH statement is correct. And no evidence, no direct evidence for COVID-19. Because remember, COVID-19 is only 79% similarity to the SARS. This one preclinical study suggests that herbs maybe have an anti-SARS-CoV-2 virus. Okay, and the RCT previous randomized trials suggest that they may be as effective as the oseltamivir against the influenza. Okay, the flu infections. Some cohort studies suggest that the Chinese herbs maybe play a role in reduce the rate of contract this SARS virus, okay, COVID-1 virus, not COVID-2 virus. And we should be aware of the safety concern in some herbs. And we're waiting for more randomized trials to come out, and we're looking for this study so we have more evidence on that. So this is my conclusion on my presentation. Thank you very much. So I'm ready to answer some questions.
All right, thank you, Dr. Weidong Liu. That was an excellent presentation. Learned a lot from that. One of the questions I wanted to ask is, if anybody is interested in looking at Chinese medicine, is kind of the confusion with all the different terminologies. Like, for example, you mentioned that for one of them, you use the initials HL. And if I tried Googling HL on Google, and I end up going to like Lupron analogs and stuff like that. So if you could help maybe the audience orient to, is there a good website to catalog these different Chinese herbal medicines for people new to the field?
Yeah, that's true. It is very confusing because it computes itself because the herbs is very complicated. They have a different many. Even one herb have many names. For example, for example, ephedra or licorice, and the licorice in Chinese, they have Chinese spelling called the ganchao, spelled differently, and they all have a botanical name, and they have a common name, and they have a pharmaceutical name. I think one of the places you may can go to is Natural Medicine Comprehensive Database.
Yeah.
So this is one of the I think so far the best databases that compile everything together. Not perfect by any means, but that at least give the people who do not read Chinese. This is English and it's available. You could search and then give you a lot of explanation.
Okay, great, thank you. And just for the rest of the audience, in case you didn't see Cassandra's text message through the chat window, on the right side of your computer screen, you have a little control panel, and there you can ask questions. If you click on the chat icon, you'll be able to submit a question to the organizers and panelists. And if you submit a question there, then Dr. Liu will be happy to answer those for you. Currently, I don't see any questions submitted yet, so I'm just wondering if maybe the audience isn't familiar with the process. So feel free to ask a question to Dr. Liu, and I'll be happy to relay those questions to him. So this doesn't classically fit Chinese herbal medicine, but another data that China's been very vocal about is the use of vitamin C in COVID-19. Do you have any comments on that?
Yes, I think I'm not followed on this vitamin C, but I do. I have heard that they did vitamin C trials on the COVID-19 patient, but we don't know the results yet, and I think we're still waiting. And there's some in the media because now this is that they've been talking about this vitamin C use for this group of patients, but again, there's no definitive answer at this time.
Okay, great. So one of the questions we just received is, I understand that the 3 medication and the 3 formula are used in Wuhan, but are they applicable to cancer patients as well?
No, I think no. These 3 medicine. If the cancer patient contract to COVID-19, these are specific for viral infection. So if a general patient with a cancer, no, these are not absolutely different category of use. So this if it's for the viral infection, when they design these drugs during the SARS outbreak, mostly for people with fever and runny nose, these kind of flu-like symptoms.
Okay, so I'm wondering if maybe the question they're asking, is it applicable to cancer patients with COVID-19 as well?
Cancer patient with COVID-19, yes, if the symptoms that if have a flu-like symptoms, yes, it maybe could be used.
Okay, great. And the next question, have these herbal formulas been used in the prodromal or pre-conformation stage of the virus when there clearly are symptoms? And if so, is there promise in their use to avert full-blown symptoms?
Well, that's a good question. I think it's very good. If you're looking at this, the Hong Kong study, I mentioned that they give these herbs as a prevention to these healthcare workers. They didn't have the SARS, but they did have symptoms. Have some of them have symptoms. Have some cough. Have some discomfort. So this is the you can see as a pre-confirmed stages. So that actually suggests that this is some role can play when in the very early stage. I think that actually might be the what the strength of the herbs. The very early stage of the viral infection, you maybe could use some of the herbs to alleviate the symptoms. Yeah, so maybe that you may can reduce the chance. But we don't know this exactly. But from the Hong Kong data, it seems a point that direction.
Okay, very good. So I don't have any questions left on the panel. So again, thank you, Dr. Liu. That was a fantastic presentation. I didn't realize astrologists had data for influenza. So that was very interesting for me as well. So thank you. And thank you as well to our organizers at ADG for help making this happen. And thank you, audience, for attending this presentation. Please feel free to remember to fill out the questionnaire at the end. We want to get your feedback on what you found useful and any suggestions for improvement for these presentations. And again, thank you for attending and stay safe during COVID-19.
Thank you very much.
Thank you, Wei Dong.
Thank you.